red palm oil.
All right.
Take a sip.
So the question is, how do I feel about oils? Again, the general principle is we want to limit our exposure to highly processed foods. Oils are highly processed and very concentrated, so we want to limit our exposure to them. Now, as far as data linking dietary fat to disease, and actually it's a good question because it allows me to talk about something I think is really important. I don't know if you guys saw, this was last year or sometime, there's a Time magazine cover that had a stick of butter or something on it, and it said that fat is no longer a problem. That, you know, the studies have shown that fat does not cause disease. And they should have put those Time magazines in potted plants because it was all BS. The fact that this is the problem though. When you look at the studies that link dietary fat intake to disease, what you see is a relatively flat curve until you get to about 15% of calories. Then you have a sharp rise in the relationship between intake and risk until you get to about 30%, and then it levels off. And from 30% onward, it's flat. So what does that mean? That means that once your intake reaches 30%, it does not matter if you're eating 30% of calories, 40% of calories, 50% of calories. You have no increased risk. You're already maxed out in terms of your risk. Does that make sense to everybody? When you look at the studies that Time magazine article was based on, all of the dietary intakes for the fat intake were in excess of 30% of calories. So no, they're not going to see a difference. It would be like if does anybody know how much of room air is oxygen? What percentage?
60.
No, it's more than 16.
No, it's
21%. Okay? All right. So if I took somebody and put them in a room that had 5% oxygen and they died, and I took someone else and put them in a room with 10% oxygen and that person died, would I therefore be justified in saying oxygen does not sustain life? No. Because the problem was there wasn't enough oxygen in either room. Likewise, similarly I should say, the problem with those studies is that the dietary intake in all of them was way too high. To see a reduction in risk, you got to get below 30% of calories. And so the optimal intake, I think, is 10 to 15% of calories from fat. And within that, you want to limit your exposure to saturated fats and make sure that you have a good dietary source of your omega-3 fats, which would be like flaxseed oils, walnut oil, and even the soybean oil actually is about 11% omega-3. Also, if you want to get preformed DHA and EPA, which are the 20 and 22 carbon long chain omega-3 fatty acids, you guys didn't realize there's a chemistry course too. You can actually get, there are vegan forms of DHA and EPA available from a company called DEVA, that are derived from algae. And then I will also take this opportunity to tell you that fish oils are not fish oils. They're actually recycled plant oils, because what they call fish oils are actually made by algae, and they're only concentrated in the fish's bodies. But the problem is that by the time they get to the fish's bodies, they've collected a bunch of toxins and other things from the ocean, and so it's better to avoid getting those oils from the fish and get them directly from the algae. All right. Yes.
Continuing on oils, coconut oil, you know, it's medium chain fatty acid, it's processed different, but yet it's extremely high in saturated fat. I go back and forth on that.
Yeah, so the question is coconut oil, and I'm going to have to take a pass because I haven't researched it enough to give you an informed answer.
Okay.
Yes, ma'am. Oh, okay, great. Question is, what about vitamin B12, which is an actual vitamin?
Right.
And people. I mean, when you're a vegetarian or vegan, the thing people like to throw up in your face is, well, first one is
Well, you get
what about
protein.
right?
Then it's B12.
And the next one is
It's B12.
And it turns out that our bodies need about 1 microgram of B12 on a daily basis. That is an amount so small, I don't even know how to quantify it for you. But it's extremely important because without it, we develop permanent neurological dysfunction as well as anemia that can lead to death. So it's very, very important. But we need it in very, very small amounts. But the key thing to know is that no animal and no plant makes B12. All B12 is made by bacteria. Okay? And the problem with us in these sort of concrete and plastic environments that we've created for ourselves is that we have eliminated the natural sources of B12 from our environment. And as a result, if you're not eating animal foods, you have to take a supplement. But it has nothing to do with dietary inadequacy. It's just a matter of where B12 comes from. It comes from bacteria. And if you're not getting natural bacterial exposure from your environment, you've got to take the supplement. Yes. I'm sorry? TLC? Chia seeds. In terms of as far as omega-3 fatty acids, chia seeds are a great source of omega-3 acids. And so are flax seeds directly, but the thing about flax seeds is you gotta grind them up because if you eat them whole, they're gonna pass through you. But you gotta grind them so that your body can extract the oil from them. Yes.
After watching What the Health, what are your feelings on people saying that people with diabetes shouldn't be eating fruit because sugar's bad for them?
Oh God. Yeah. It's crazy.
Yeah.
And the reason I laughed is because I mentioned to you that I had a patient in my clinic when I was working at a free clinic who became a vegan, and she cured her diabetes. Her name was Kathy. When I started taking care of Kathy, she had diabetes for 17 years. She was on insulin twice a day, plus oral tablets, and her blood sugars were still averaging 250 to 300.
Wow.
And as you know, your blood sugar should be like around 80 to 90. She had claudication or blockages in her legs that had gotten so bad that she had to quit work. She was disabled. She couldn't walk a block without pain. And she would tell me that when she got up in the morning, she had to sit on the side of her bed for about 20 minutes to, one, let her eyes start to focus, and two, to let her brain clear. And I started talking to her about changing her diet. And I'm gonna be honest, I was hoping that she would become vegetarian. And Kathy blew me away. She became completely vegan. And within 6 weeks, I had to take her off all of her diabetes medicines. But the one thing that I could not get her to do was to eat fruit, because she was so used to her doctors telling her that it was going to make her blood sugar rise. And I kept telling her, Kathy, if you eat whole fresh fruit, it has fiber in it, and it won't raise your sugar. And she was like, no, Dr. Mills. And one day, she used to go to some lectures with me sometimes, and she would tell the story, and she's really funny because she got really mad at me. And so she decided, she said she was going to show me. She was going to eat this fruit to show me that it was going to raise her blood sugar. And so she ate some fresh strawberries, and it did make her blood sugar. So yes, if you eat whole, fresh fruit, it's fine, because it has fiber in it that modulates the absorption of the sugar and does not and will not cause a blood sugar spike. And okay, I'm a science geek, okay, and I really get like super excited about this stuff because I was just reading a paper on carbohydrate digestion, and what's really cool about our carbohydrate digestion is we have an enzyme in our saliva called salivary amylase that actually starts the breakdown of carbohydrate as we chew our food. But salivary amylase doesn't generate individual sugar molecules. It actually kind of breaks up the starch molecules into fragments, which starch is just long chains of sugar molecules. So it breaks it up into fragments, and it doesn't do anything to sucrose, or which is table sugar, regular sugar. And sucrose is a disaccharide, meaning it's two sugar molecules joined together, and our body can't absorb them until they've been split into the individual glucose, fructose. And that's done by a brush border enzyme, meaning an enzyme that's attached to the lining of our intestines called sucrase. Likewise, the enzymes that actually break up these starch fragments into the individual sugar molecules, again, are the brush border enzymes that are attached to the lining of your small intestine. Well, if you think about the presence of fiber, fiber actually interferes with the ability of the starch fragments and the sucrose to come in contact with those brush border enzymes, thus delaying the generation of the sugar and sugar molecules and the absorption of that sugar. That's one of the ways starch modulates the absorption of sugar. I mean, it's a beautiful system. It's designed to make your blood sugar, raise it up to a reasonable level, and keep it that way for an extended period of time so that you don't get hungry all the time and you're not constantly eating. But what do instead? We go out and we eat a bunch of greasy stuff that has a lot of processed sugar in it. Blood sugar spikes up really high. We dump out a bunch of insulin, which then makes our blood sugar go really low. Next thing you know, we're hungry again because our blood sugar level is low instead of being at that nice, medium level like it should be. So anyway, when it's done right, starch is your friend. Or excuse me, fiber is your friend, is what I meant to say. Yes, ma'am.
You talked about the connection between our diet and chronic diseases. Can you say anything about cancers, certain cancers?
Sure. The question is about what about our diet and cancers? Again, there's a direct link. The number one cancer in America is lung cancer for both men and women. And that's obviously primarily related to smoking. However, there are a number of people who never smoke who do get lung cancer. And studies have shown that there is an inverse relationship between your intake of fresh fruits and vegetables and your risk for lung cancer. So in other words, the more fresh fruits and vegetables you eat, the lower your risk for developing lung cancer. The less you eat, the higher your risk. But there is a direct link between the intake of meat, dairy, and other animal foods and cancers like colon cancer, prostate cancer, breast cancer, and pancreatic cancer. So many of the major cancers that we see in Western countries, particularly in the United States, are directly related to the way and we eat and live. And if we change our diet, the risk for these diseases is markedly reduced. Now, speaking of what the health, there was some criticism of the movie because there were people in the movie who talked about having cured cancer by changing their diet. And there were some individuals who felt that those claims were non-scientific, and so therefore it was not appropriate to put that in the movie. I disagree completely because in fact, there are people who have cured their cancer with diet change. I personally know a woman who cured her breast cancer with by changing their diet. Dr. Ruth Heydrich, who's a very famous ultramarathon runner, she's in her late 70s now, got breast cancer and became a vegan and cured her disease. That does not mean it's going to work for every single person, but it does work. And so it's just as false not to tell people that this is an option and that this can work as to say it's going to work for everybody. It may not work for everybody, but it does work for a lot of people. And there is no question that being plant-based will markedly reduce your risk for developing those diseases in the first place. And studies have shown consistently that even after diagnosis, if you change to a plant-based diet, it improves survival and reduces your risk of disease recurrence. That's beyond dispute. Yes, hand it back.
There is a perception that if a medical doctor starts promoting plant-based diet and it outweighs their promotion of pharmaceuticals, it outweighs their promotion of drugs, that they actually risk losing their medical license. My question is this an actual concern? And if so, is there anything we can do about that?
Okay, did everybody hear what he said? Okay. As physicians, we're all required to adhere to what's called standards of care, and what standard practices are for treating a particular disease. And we're also responsible for making sure that our patients are fully informed about whatever therapy we're recommending. So, for instance, let's say a woman comes to my office and she says, Dr. Mills, I've just been diagnosed with breast cancer. If I were to tell her, well, my recommendation is that you just simply become a vegan and, not do any traditional therapies, yeah, I would probably lose my license for that, and rightfully so. Because what I should tell her is exactly what I told you before, that studies show that converting to a plant-based diet reduces risk of recurrence, increases longevity, and that there are cases where individuals have been able to cure themselves of the disease with diet change. My recommendation for any woman in that situation, or any say man who, say someone with colon cancer, would be to have the tumor removed, then change your diet, and make an individual decision about whether or not to do adjuvant chemotherapy, just depending on the relative risks and benefits of that particular chemotherapy. But a doctor can only be in danger of losing his or her license if they fail to adhere to standards of care, or if they do not adequately inform their patients about alternative therapies that they recommend.
Kaiser Permanente has recommended their doctors advocate a vegan diet.
That's absolutely true. She just brought out the point that Kaiser Permanente actually has now recommended that its doctors incorporate plant-based therapies into their treatment of their patients, because they recognize that the evidence shows that it's beneficial. So, yes, but it's in conjunction with standards of care, and as opposed to just in lieu of. Yes.
I thought someone would give you the mic, but it's okay.
No, she'll bring it.
I didn't want her to stick it in my face. Thank you while I was talking. Thank you for your time and coming out to speak with us, first of all. So, what websites would you recommend for people who would like to start a vegan diet and maintain one without any fake news, and to, have both sides from different opinions?
When you wait, don't take it. When you say both sides, what do you mean?
Maybe that was phrased wrong, but I liked how you gave your opinion, and then what other doctors or other medical professionals have their opinion. So I think different opinions, not both sides, but various opinions.
Okay. Websites that I would recommend are certainly PCRM, Physicians Committee for Responsible Medicine. They have a very good website.
Say that again.
Physicians Committee for Responsible Medicine. It's actually PCRM.org. PCRM.org.